talk a little bit about social and environmental influences and their effects on the care of children and the growth and development of children in general. So some basic concepts. I just want to refresh your memory back when we were talking about growth and development of children. We talked about two theories that are important when we consider how children's growth and development is affected by the environment around them. So the first theory was the ecologic theory, and as a refresher, it really dealt with everything around the child and how that has an impact on their growth and everyday life. So it includes the family, who they live with, and the various different parts of the environment that they may interact with on a day-to-day basis, such as school or daycare centers, YMCAs, teams, churches, things like that. The resiliency theory, as you recall, was all about what factors children had that enabled them to respond to stressors and changes in their environments. And there were various different protective factors that we had and risk factors. So in terms of protective factors, we could talk about how children may have a full family at home there to take care of with them, that both parents, one parent may work, the other parent may be home with them. They're an easygoing child, an easy adapting child, as opposed to somebody with risk factors such as poverty. They may not have a consistent care provider at home. They may be at home being raised by an older sibling while parents are outside the home working. And you can see how both of those scenarios could have positive and negative influences on a child's growth and development. So let's talk about some basic social influences that we see. First of all, poverty. And I'm not going to belabor this because we have talked about this a lot throughout your training in the nursing division. And we've talked about it a lot when it comes to community home. But it's incredible when you think about the greatest risk in our healthcare is poverty, and especially in children. About 20% of the United States children today find themselves in poverty. And when you look at some of those stats, you can kind of see single homes have much more poverty than homes with two parents. African American and Latino based homes have a lot more poverty in them. And you know, when we look at those types of things, we really need to pay attention and really think about the impact and what impact we can have when we look at those different communities. So consequences, again, unsafe housing, not enough food, malnutrition, which then breeds other healthcare conditions for children, or health conditions that we worry about they may not be getting, the basic primary care they need to provide for growth and development in a healthy way. Homelessness, we know the impacts of that, and 1/4 of the homeless population is children. And that's a scary number, I think, for all of us to really think about when we know the impact from many of our other coursework and community homework, what the impact of homelessness can have. So let's talk again about stress. Again, this is something I'm just going to briefly touch on because we've talked about trauma-informed care a lot in your training, and I've really begun to hear more and more about this over the past several years. And in fact, in your community home rotations here, as we finish out this term online, we will be spending a day where we are talking about trauma-informed care and the effects of stress on adults and children alike, and really kind of expanding on that in the communities we work in. So you'll get more about this. But what I want to draw your attention to is how children manifest stress, because it may be very, very different from adults, and we may not always recognize that the child is actually experiencing stress. So we may have their behavior regression, which we've talked about. We often see that in children in hospitals where their behavior will regress a little bit because of stress. But we can also see children act out, become a little bit more violent, have an inability to concentrate on things. Opposite of that, we may see a child who has the inability to interact, kind of pulls themselves in, pulls themselves off, away from others, maybe very sensitive, and all of those things. So on either end of that behavior continuum, we can see behaviors in these children that may be an indication that they are experiencing stress. And we know that long-term stress begets a lot of significant chronic health conditions, and we've seen that link today in much of our research. And it is one of the reasons why we are paying so much attention to it. Family has a big influence on children. It is probably one of the greatest influencers besides poverty. And when we look at this, what we generally look at is how many parents are in the home, how many siblings exist, where does the child fall in the pattern of siblings, oldest, youngest, middle, etc. The divorce rate in the United States is approximately 50%, give or take, and that does have a significant impact on children. There's just no way that it can't. And so I have listed there a little bit about how children at different ages may respond to divorce. So our younger children who don't really have conceptually an understanding may misbehave a little bit more or show signs of being very angry or anxious. As we get a little bit older, those children tend to blame themselves. It was my fault that mommy and daddy didn't stay together. As 9 and 10-year-olds in that school age bracket, they start to get really angry and pissed off at the world and what has happened to them. And that continues into our adolescent time frame in terms of just being very angry, rebelling, acting out. We start to see some of the behaviors sort of be much more large in their response, I guess, much more of an exaggerated response. For some of the normal acting out that adolescents do, we actually see it. It's almost like it's on steroids. It's so much worse in situations of stress like this. School and daycare has a definite influence on growth and development. How involved are the school nurses involved in the health and wellness of the children? Many of the children in our inner city schools and in areas of poverty, the school nurses are the ones who are managing their day-to-day care and their primary care. But as we look at a lot of schools losing their school nurses, this becomes much more of a concern. The community, where do you live? Do you live in areas where we have a lot of pollution or exposure to a lot of potential compromise in terms of chemical exposures, pollution exposures? Do we live out in a very rural area and thus we don't have a whole lot of interaction with other people and a lot of exposure to other things? And of course, culture, we know, and again, that makes sense. We all understand how culture can have an impact on growth and development. Some lifestyle activities. So there are a lot of lifestyle choices that children and young adolescents will make that will have an impact on their growth and development and how their health status is overall. Tobacco use and especially e-cigarette use. I'm not going to belabor this. We have talked about this over and over in so many different classes. But this is a significant issue and one that we need to address, especially in the era of e-cigarette usage and some of the complications we're now seeing with nicotine addictions in especially our late school age and adolescent populations. Additionally, alcohol and substance abuse is something that we are dealing with. Of course, in our area, we have a significant amount of drug abuse and substance abuse, alcohol abuse in the Philadelphia and the greater Philadelphia area. What's very interesting is that looking at some of those numbers in 12th grade, 76% of females and 75% of males have used alcohol in some way or form. And then, of course, we have all of the other medications, not only over-the-counter, but illegal substances that children or adolescents are getting involved with. So substance abuse we need to pay attention to. Again, this is something that you've likely been exposed to elsewhere, but oftentimes we see it's either a pressure situation, a peer pressure situation that we attempted and try it, or it's a means of trying to find relief from anxiety and stress, and they see it, they have access to it, and so they go ahead and try it. We all know that there are great consequences to drug use, substance use of any kind, whether over-the-counter or prescriptive or illegal substances, and something that more and more we are seeing and having to address in our younger and pediatric populations. Lifestyle choices. I had mentioned that back when we were talking about school-age children, how we were losing a lot of gym class and playground time, and that is just leading more and more and more to an increased sedentary lifestyle in our young children and adolescents. And that's a grave concern because we know sedentary lifestyle leads to chronic or health conditions. And add to that all of the video games and the media platforms that we can access and the social media platforms we can access, and how that can really just absorb so much of the time, and it's taking away from that physical activity they so desperately need. we also have to think about that in terms of where children live. And that's where we bring the environment into things and say, if you're living in an area where it's unsafe to be outside and get that physical activity, that obviously is going to be more concerning. And we need to work with those children to come up with ways to get physically active in a unsafe environment. Again, I don't need to belabor the points in terms of what could be caused health-wise, long-term health-wise, in terms of diabetes and cardiovascular disease with a sedentary lifestyle. And the earlier we start, the more likely these secondary illnesses are likely to develop. In children, we also have to think about the activities that children get involved in, and in particular here, we really talk about protective equipment and the availability of that. We have all heard about the concussion issues that we are having in a lot of our sports, everything from cheerleading to football to soccer, and all of those things we're getting more and more heightened awareness of. We've come up with concussion protocols and whatnot, all as a result of some of the negatives we are seeing. So making sure that children and families understand the need for protective equipment, not only for head injuries, but for lots of other injuries as well. We are most aware of head injuries and the need for helmet and proper padding. And there are so many of these extreme sports kids are getting involved in that are just adding to the list of risks that the kids may have. We want them physically active, and on the flip side, we need to think about protecting them in the process of doing those activities. So some of the extreme sports that we are noticing is a general increase in especially head injuries. You can see them listed there. And again, a lot of them are considered more of these extreme sports that are happening more and more, and we're introducing as a society our children to many more of these activities earlier on. And again, I go back to we're in that balance of getting that physical activity and that involvement often with other family members doing these activities, but weighing that against the danger posed to children, especially children who are not fully developed physically yet, let alone cognitively, and thus the injury to brain injury could really be devastating. Body art, we often see this in our adolescents and young adults, and just the tattoos, the piercings, and all of the other types of body art that we see. We need to be making sure that we are addressing these types of things, what to look out for to go to in terms of services that can do these things for these young adolescents or adolescents and young adults, but doing it in a way that is in a controlled setting, that is clean and sterile, and teaching them how to take care of those choices that they make. So being aware of them, talking about them, asking about them, because remember, we don't always see them. Depending on where we're interacting with the kids, we may not always see them, and it's important for us to address those and the care of those, as well as what to watch for with complication. Lifestyle choices also have a significant impact on the growth and development of children. Most teens do feel an attraction to the opposite sex, but there are obvious other lifestyles that we're all aware of, and the issues that those populations experience over growth and development are a concern, and something that we need to be much more open and address much more openly. As well as just getting more and more comfortable with asking those types of questions or open questions with the young adolescents that we work with. I think it's important that we get comfortable asking those questions in ways that are open and inviting in terms of getting the appropriate or the most open and honest information possible. And I think that's something that everybody needs to learn how to do. And hopefully, we are actually working in the labs right now to hopefully next year begin to bring in some simulations for all of you that do bring in LGBTQ issues, which I think will be phenomenal. And proper ways for us to address those populations so that we are doing it in the best interest of those patients. Health risks we do see, they are both mental health risks, which are a lot of those in terms of harassment, bullying, rejection by family or peers for those lifestyle choices. But we also do see a greater indication of substance abuse, STIs, homelessness in populations that have different sexual orientations. And again, being aware of those helps us be much more ready to ask about them and assess for them, and that's the most important part.